To welcome people back to our final round of hearings today in the Public Accountability Committee's oversight hearing into the COVID response by the New South Wales Government. The last session that we've just had and this session are both dealing with COVID in prisons and what the government's response has been. We have the Acting Commissioner of Corrective Services, Commissioner Kevin Corcoran. We have the Inspector of Custodial Services, Ms Fiona Rafter, the New South Wales Ombudsman, Mr Paul Miller, and Ms Wendy Hoey, the Executive Director from the Justice Health Network. If I could ask each of you, perhaps in the order in which I just introduced you, to each give your name and your title and take either an oath or an affirmation, copies of which should have been provided to you by the Secretariat. Acting Commissioner.
Yeah, thank you, Mr Chairman. Kevin Corcoran, Acting Commissioner of Corrective Services, New South Wales. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thanks, Acting Commissioner. Ms Rafter.
Thank you. Fiona Rafter, Inspector of Custodial Services. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth.
Thanks, Ms Rafter. Mr Miller.
Thank you. Paul Miller, New South Wales Ombudsman. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth.
Thanks very much. Ms Hoey. You're on mute, I'm sorry, Ms Hoey.
Rookie error. Wendy Hoey, Executive Director of Clinical Operations for Justice Health Forensic Mental Health Network for New South Wales Health. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth.
Thanks very much for your attendance this afternoon. There's an opportunity now, if you wish to take it, to give a brief opening statement. Does anybody wish to take that opportunity?
Yes, I would like to, Mr Chairman.
You proceed.
Thank you. I'd like to begin by acknowledging the traditional owners of the land on which I'm present today, the Gadigal people of the Eora Nation and their elders, past, present and emerging. I'd like to just give you a brief overview of what Corrective Services New South Wales has done to tackle this COVID-19 pandemic. Most of the measures that were introduced were very soon after it began last year, and we've always followed the expert advice of New South Wales Health and its Justice Health and Forensic Mental Health Network, which provides healthcare in public prisons. The safety of staff and inmates is our #1 priority. So what do? We initially set up a 7-day-a-week command post to coordinate the response of our 9,000 staff at over 100 work locations. The PSA has always been embedded in the command post along with Justice Health. All fresh custody inmates are managed in quarantine for 14 days before being cleared to move into the general population. Just recently, we have set up further staging areas around the state. Inmates who test positive for COVID-19 are immediately isolated and receive appropriate medical treatment. Masks and eye protection are mandatory for all staff. Increased PPE requirements apply for staff in contact with fresh receptions and inmates in quarantine and isolation. Inmates have been provided with masks and sanitary arrangements. We have introduced rapid antigen screening at key locations for staff and inmates. Prison transfers have been restricted as much as possible. In-person visits have been stopped, and we have greatly increased the number of video visits and phone calls available to inmates. We've suspended all forms of external leave apart from special circumstances. Our staff are on the front line of this pandemic just as much as the more visible emergency services workers, and they've been doing a magnificent job in a very difficult situation. Well, that's a brief summary, Mr Chair, but I'm sure you'll want to know more details and I'm happy to provide as required.
Thanks, Acting Commissioner. Does anybody else wish to provide a brief opening?
I have a brief opening statement as well, Mr Chair.
Thanks, Ms Rafter.
Thank you for the opportunity to appear before you today. I would like to firstly acknowledge the Gadigal people of the Eora Nation. The Inspector of Custodial Services is an independent statutory office created in October 2013 pursuant to the Inspector of Custodial Services Act 2012. My office published its Inspector of Custodial Services COVID-19 plan in April 2020, and that has guided our work during the pandemic. Plan states that ICS will monitor the planning and response to COVID-19 and that a review of agency responses would be necessary after the COVID-19 pandemic. The ICS has adopted a do no harm approach to its activities throughout the pandemic to avoid placing any burden on relevant authorities and staff that reduces their capacity to respond to COVID-19. Although this has resulted in some visits and inspections being postponed since March 2020, the ICS staff have completed 85 liaison visits, 40 that were specifically for COVID monitoring purposes, and carried out full inspections of 6 correctional centres. One of my priorities during the pandemic has been to keep the official visitor program operating. And that is when I was also aware that other jurisdictions and other community visitor programs in New South Wales had been suspended. There are over 90 official visitor appointments to 56 custodial facilities across New South Wales, and they have conducted 1,591 visits since March 2020. With the cooperation of Corrective Services New South Wales and Youth Justice, a free official visitor phone line and mail service was introduced at all centres in May 2020 and is still currently operating. We are in the final stages of implementing official visitor virtual visits at all centres to complement in-person visits. Since February 2020, I've liaised closely with Corrective Services New South Wales, Youth Justice and Justice Health and Forensic Mental Health Network on their response to COVID-19. In addition to regular meetings since the pandemic commenced, I received notification of COVID cases and regular updates from Corrective Services and Justice Health and Youth Justice. To their credit, I have observed Corrective Services, Youth Justice and Justice Health working collaboratively and constructively on this response. Although the custodial system in New South Wales has done remarkably well in responding to the threat of COVID-19 throughout the pandemic, following an outbreak in the New South Wales community in June 2021, COVID-19 disease was detected in young people and adults in custody as well as staff who acquired the virus in the community. Given the increasing number of confirmed cases of COVID-19 in the custodial system, I therefore determined to formally commence a review of the response to COVID-19 in New South Wales custodial centres and services. The terms of reference are on my website. However, as we commence this review, we will also continue to have regard to the do no harm principle that has guided our monitoring during the COVID-19 pandemic. Thank you.
Thanks, Ms. Rafter. Mr. Miller?
Thank you, Chair. Just a short statement. I'd like to begin just by acknowledging that I am on Gadigal land and I pay respects to Elders past, present and emerging. Just a brief comment. While I've not been able to tune into all of the proceedings of this committee, I have heard occasional comments that might seem to suggest that being in the midst of a global pandemic or other crisis is not the time for oversight and scrutiny. I just want to put on record the Ombudsman's fundamental disagreement with that proposition. Since the outset, some 18 months ago, we have noted that, in many respects, appropriate oversight and of particular relevance to us, avenues for external complaint handling need to be embedded as an essential part of crisis response. This is particularly so when normal mechanisms of accountability, like Parliament itself, may be impeded, where government and its agencies are exercising extraordinary intrusive powers and where they are reacting to unprecedented situations in new and untested ways. The value of people having an avenue to question and to complain is not important just because it is a fundamental democratic right, although it is, but also because there are always opportunities to learn, adjust and improve, and because it can enhance public confidence and trust in what is being done. In this way, far from getting in the way of effective crisis response, appropriate oversight supports it. For that reason, we were very pleased by the Inspector's announcement this week that she will be undertaking a review of COVID response in correctional and youth justice centres, and I have, of course, offered all assistance my office can provide to aid her in that important work. Final point I'll quickly make is just to put on the public record my thanks for the small team of the Ombudsman's office who have staffed the phone lines into correctional and youth justice facilities for the past 18 months, sometimes like now from their own homes. I thank them for their commitment to that important work.
Ms. Hoey?
Thank Thank you, Chair. I don't have a statement. I'd just like to acknowledge the traditional owners of the land that I sit on today, and that's the Bidjigal and Gadigal people of the Eora Nation. And I'd like to commend the elders past, present and emerging, but I don't have a statement. I'm sure you've got enough questions for me. Thank you.
Well, I will now hand over to the opposition, Ms Moriarty.
Thank you, Chair. And can I just start by actually thanking all of you for your participation today and for the work that you have been doing and your organisations have been doing, and particularly on behalf of the opposition, the team at Corrective Services, all of the guards and the frontline workers who are doing terrific work. It matters to all of us, and particularly the team at Justice and Forensic Health. It's very, very important to all of us and appreciated by all of us, the work that your staff do. Acting Commissioner, if I might start with you, if I could. Can you tell us, as at today's date, or as most recently as you can, how many positive COVID cases there have been in corrections, so staff and inmates?
Yeah, unfortunately, I won't be able to answer that question because Health is the lead agency for all those COVID-related matters. So I'll hand over to Wendy, if that's all right.
Sure.
Thank you.
Thank you. Thank you, Kevin. To date, in the custodial environment, there's been 325 COVID positive cases across the system. Just of note, one of them was prior to Delta, and the rest have all been since Delta, and that one did come from Victoria. And 84 of those cases have been from Aboriginal people. What else?
And do you have a breakdown? Just is there a breakdown in those numbers of inmates and staff?
So that's all inmates or patients, I like to call them. Sure. I can certainly. Would you like staff? I've got my staff of today.
You can take it on notice if you don't have it available, but it would be useful.
Yeah, I mean, we've got a lot of information here for you. In which order we give it? I will. I'll start with probably just describing. There's been three centres. Partly, I'm going to answer any of your questions in relation to the public centres. That's the centres that I manage. So I'm not in any of the private operated centres. Don't report to me. So just from staff and from patients. First of all, we'll talk about Bathurst Correctional Centre, because that's one of the centres that has had some staff, and there's been 2 Justice Health staff have deemed positive within the Bathurst Correctional Centre. There's been 12 Correctional Services staff. From MWRC, our Metropolitan Remand and Reception Centre, there's been 2 Justice Health staff, and there's been 15 Correctional Services officers. We have had a couple of other centres where there's been staff on the Long Bay campus at Long Bay here, where we've had 1 Justice Health staff and 7 correctional staff. And also in one of our youth justice centres, there was 6 youth justice officers and no Justice Health staff.
Thank you. Can I ask, and I guess this is probably for both of you, so I don't mind who starts, but essentially who is responsible for the management of the COVID protocols and planning in corrections proper? So obviously corrections has its role, Justice Health has its role. I'm wondering, first of all, who is ultimately responsible just for the rules that are in place, and then how that works between both of your organisations.
Look,
Kevin, do you want to?
Yeah, I might start off on that. Yeah, we have a series of Commissioner's instructions which relate to the rules and protocols that we have in place, but of course they're all based on health advice, and we just make sure that we seek that advice before we make those determinations. But those determinations are the thing which govern the way we make sure that people have protocols or procedures in place in the correctional system.
And for Justice Health, what kind of input do you have into that?
So I think what has to be said from the very beginning of this pandemic, Justice Health, Correctional Services and Youth Justice have worked extremely closely together. I think we realised at the beginning of this that we couldn't do it without each other, so it's been an absolute collaboration. We work very, very closely with them. So health holds, at this current time, 5 to 7 days a week, we hold a teleconference in the morning where we have Youth Justice, we have ourselves, we have the representative from the Inspector of Custodial Services who dial in, and we discuss what's happening and the state of play and such like. And then if there's policies, procedures to be made, to be developed, we do that in consultation. And from a health perspective and from Justice Health, Forensic Mental Health, we certainly would involve our public health at the Ministry, New South Wales Health, and we take advice from them, and also our SHEOC, which is our State Health Emergency Centre. So there's a bit of a matrix happening. I think we have very hotlines to each other, but so we would sign off on the health policy, and Corrective Services would manage the logistics and the security component of it. And Kevin and I were speaking about this, and we both sort of have a shared responsibility around the welfare, which we do. So health policy certainly comes from us, security from Kevin, and we work very, very closely in that.
And so, can I just confirm, so the daily teleconference, does that includes Corrective Services as well?
Corrective Services, everybody, yeah.
Right. And so what about in terms of managing cases? So look, I mean, one of the things I'm going to quiz you on, and one of the things that's really of public interest here is the lack of transparency around what's happening in this particular outbreak. And I know that it's complicated because you both have different organisations, and then there are private organisations in the mix. And I'm wanting to understand how that all fits together, and how information might not be being communicated. So how maybe the best way to start is Acting Commissioner Mr. Corcoran, do you what kind of oversight do you have over the policies that are in place in each of the correctional facilities around the state? So you guys set them at a high level, but then what happens to them in each facility on the ground, because they all run their own operations?
They all run their own operations, but they must comply with these commissioners' instructions. So, you know, we have total oversight from that perspective. So the command posts that we have in operation are the ones that generate these commissioners' instructions, and they go through really extensive consultation. And as I said, you know, previously in my introduction, the Public Service Association are actually embedded in this command post. So, you know, we've got constant feedback coming from staff all around the state. You know, just recently we had, you know, issues where we were looking at how we were going to make sure people coming out of MRRC into the regions were going to be safe. So we engaged in, you know, teleconference or video conferences with up to about 150 PSA representatives from all around the state to talk it through with them. The command post did that sort of work, and generated a response which was really made sure that we were covering off on all the concerns of staff around the state.
Does that oversight apply equally to the private prisons, private facilities,
Yeah,
I should say?
Yeah, it certainly does, and obviously, you know, we contract out to those private providers, but nevertheless, they must comply with those commissioners' instructions.
And have they complied?
Look, in general, they have complied, yes.
Okay, so specifically, have they complied? And let's turn to Puckley firstly.
Sure.
So clearly that was the source of the first outbreak in, well, some youth detention centres that had small cases, but Puckley was the source of this big outbreak. And there are mixed reports about when that information about that situation was made public. Can I ask when you were first told about positive cases at Puckley?
Look, I was told as soon as it was made available, that information was made available to the command post. You know, we get text messages as soon as we hear about positive cases, and I was aware as soon as the command post was aware.
What
I couldn't
date?
give you a specific date or time.
Well, can you though?
I'd have to take that
you
on
don't have it in
notice.
front of you?
Say again?
Can you give me the specific date? It's actually very important. You're welcome to take it on notice if you don't have it in front of you, but if you could provide the specific date that you were notified. And also, I'm interested in what the requirements are. Well, first of all, will you take that on notice?
I shall take it on notice, yes.
And secondly, so what is the requirement for each facility to notify you? So presumably you have incident reporting, but in terms of COVID specifically, when is each facility required to tell you through whatever channels of positive cases?
Yeah, so that information generally would come from health. So in the case of Parklea, that would be St. Vincent's Health. That would notify us of some positive case that was found in the facility.
So is the requirement that each facility have to notify health or notify the COVID command or your command?
In the private centres, they have their own health providers, but in the public centres, that would be the responsibility of Justice Health.
So, okay, so, but in terms of notifying, so is there no requirement for facilities to report centrally to corrective services if they have cases, or are they required to notify?
Yeah, look, everybody's required to notify the command post as soon as possible. That's why we have a command post. It's a central location and a repository for all the information that comes in, because as soon as we find out about a case, whether it be an inmate or a staff member, we start our contact tracing to make sure that we've got a handle on who should be isolated as a result of that positive case coming forward.
Yeah. So, but in terms of the requirement, so I mean, is there a time frame? Are they supposed to notify immediately? What is the process?
Yeah, the notification should be immediate. Now, we really need to know as soon as possible so we can start our contact tracing protocols.
Right, and you'll take it on notice that you'll give me the date or the committee the date for when you were notified by Parklea, but do you know if they did notify you immediately? Because there's information and reports that they knew for days and didn't tell anyone.
Well, if that's the case, then I'm not aware of that information. And as I said, we would be required to be notified immediately through the command post of any positive case that has come up.
Do you know how the outbreak started at Parklea?
Look, I'm not 100% certain at this point in time, but what we have done is engage University of New South Wales Kirby Institute to have a look at the situation in Parklea, so an independent body coming in to have a look at that, and we'll await their report on their views on how that outbreak occurred.
When is that report due?
I haven't got a date on that yet.
So that it's just open-ended?
No, it won't be open-ended.
I mean, they must have to tell you at a certain point. We're in the middle of an outbreak inside of your service.
Yeah. Well, their investigations are still continuing, and as soon as they finish those investigations, they'll be reporting to us. So, it's not that they're, going to take a couple of months to do this. This is happening actively, and we want to make sure that we get that information as quickly as possible, because we really need to know, if that, how that occurred, and what we need to do to make sure it doesn't occur again.
And will that be publicly available once it's complete?
I don't see why not.
Is that a yes?
Yeah, that's a yes.
Thank you. I guess moving on from Parklea, but starting from there. So Parklea is the private operator, but correctional services are responsible for the transfer of people to other facilities around the state. What protocols do you have in place to make sure that when people are transferred, they are not at risk of being COVID positive, or do you have protocols in place?
Well, I guess we've really adopted a belts and braces approach to this, and at this point in time, we have MRRC as the sole repository of all, along with Silverwater Women's, of all the metropolitan quarantine and isolation. So that means that for 14 days, we keep people in quarantine in those two facilities in the metropolitan area. Obviously, we have this sort of scenario occurring out in the regions where we've got receptions as well. But in the metropolitan area, what we have confined it to, the main repository is the NRC. We get about 1,000 fresh custodies a month through that facility, so it is quite substantial. And we have had to put aside a lot of quarantine and isolation beds to ensure that we can process people and get them moving. We do have to get them moving out of NRC. We do have to get them moving out of NRC because that is critical to the flow in the system. Otherwise, we'll get blocked up with police cells and we just can't process people. So what we've done to facilitate that is we've established staging posts out in 4 correctional centres in the regions where we keep them for another up to 7 days and they have to clear another test. So prior to going to those staging areas, they have to clear with a PCR, and off in those staging areas, they have to clear with another PCR test. So we're very confident we've got protocols in place that will make sure that we don't get any further leakage out of those quarantine areas.
How long has that protocol been in place?
It's only been in place in the last week or two. And that's it. That's obviously, something that we had to, negotiate and consult with, our PSA colleagues around the state and make sure that we came up with the best solution. And, I believe that we've really come up with an excellent solution there, but it's been done in conjunction with health and conjunction with our PSA colleagues.
Yeah, that's great. But before the last week or so, what were the arrangements in place? Because people were transferred. It's been reported that positive cases were transferred.
Yeah.
Was there a failure before the last week to test people and to have systems in place to make sure that positive cases weren't moved to other places to then first cause spread?
Those sort of things. Let me take Parklea, for example. We knew once we had those cases that they'd come out of quarantine, and we found these cases in the general population of Parklea. I immediately closed down the entire system. 198 inmates were transferred from Parklea in, I think, the 2 weeks prior to that. And we then made sure that we cleared every correctional centre. So isolated those people that come from Parklea and put them into 14-day isolation with testing to make sure that nothing had leaked out from Parklea. There were no positives that came out of that 198. So this is when we started thinking about how are we going to make sure this doesn't happen again. And that's why we put in place these staging areas in these 4 centres so that we've got additional quarantine and additional testing before we put anybody out in the general population.
So that's good for now, but the outbreak has already happened. So why wasn't this in place before this outbreak?
Yeah, because, we're operating on, health advice that 14 days quarantine is what we need, and we were testing on day 1 and day 12. And when you think about it, that's what they do in hotel quarantine.
Well, I mean, with respect, this pandemic's been going for over 18 months. You managed to get through last year without too many cases. We've had a massive outbreak in the last 6 weeks or so, massive. Huge implications, big health issues. I'm told there's a corrective services officer on life support. It's really not good enough that you're only putting some systems in place in the last week or so. Wouldn't you agree?
No, we've had systems in place for the entire. What we've got dealing with is the Delta variant, and I've got to say it is far more contagious than what we were experiencing last year. So we've had to adapt and be a little bit agile about how we're dealing with this Delta variant, and that's why we're putting in additional measures that we weren't aware would be required. The previous COVID variant, wouldn't have required these sorts of measures.
Was it not required because essentially corrective services just didn't do the work to prepare properly in the nicest possible way?
Well, I've got to say, we did massive amounts of work and massive amounts of consultation, and we took all the health advice in relation to this. So, 14 days quarantine was regarded as acceptable, and testing, PCR testing was also, regarded as essential. But we've done a whole range of other things too, such as rolling out rapid antigen testing in a variety of the reception areas around the state.
But that's been since the outbreak. So all of these things that you're talking about have been after the outbreak.
That's right, after the outbreak.
Why weren't they in place before in order to stop the outbreak?
Well, you know, our best advice at the time was 14 days quarantine was acceptable. We don't know what caused that outbreak yet in Parkland.
And so can I ask, are you following the health advice with all of your systems? So it's been reported to me that there are cases where your COVID command centre and command other people in management positions are pressuring or directing staff to return to work before the 14 days. Is that happening? Can you comment on that?
Yeah, that's definitely happening. And the reason it is happening is because of health advice, because we are getting advice from Justice Health, their population health branch. What we've initiated is a protocol where we've got our own contact tracers. We've got about 100 contact tracers, which are looking at every contact that a staff member or an inmate might have and analysing that through. So we feed that data into population health, and population health will then make a judgment about when staff can return to work.
Right, so I'm out of time, but can I just to wrap that up, are you saying that you are not complying with health advice? Because if you are directing your staff to return to work after being exposed or not having a negative result before the 14-day period, that is against health advice. So are you confirming that that's what you're doing?
I'm confirming that we are following health advice. The health advice comes from population health, which is part of Justice Health.
But you're instructing people to come back before the 14 days.
That's correct, and that is on the basis of health advice.
I'm going to come back to this.
Yeah, thanks, Ms Moriarty. Mr Corcoran, your secretary, Mr Coots-Trotter, told Budget Estimates that the cause of the outbreak in Parklea was a quarantine breach. Are you saying that evidence now is contested or somehow wrong?
I'm saying that what we're doing is engaging Kirby Institute to have a look at making sure that that was the case and giving us that information from their investigations. So they've got epidemiologists and infection control experts having a look at that. And I think, I would like to wait and see what the outcome of that report is.
Mr Corcoran, 3 weeks ago, the Secretary of DCJ was able to tell a parliamentary committee that it occurred due to a quarantine breach. Are you saying now that that's in question?
I'm not saying it's in question. I'm saying that I would like to wait and see what the report is before I come out and make a definitive statement. It very well could have been a quarantine breach.
It was a quarantine breach, Assistant Commissioner. Your own secretary said that. Why do we get this? Why are we quibbling with it now? It was a quarantine breach, wasn't it?
Yeah, it could have been a quarantine breach.
It was. You know it was, Assistant Commissioner. So why won't you tell us that?
Well, we've also got a situation where we've had positive staff members as well in that facility.
But Assistant Commissioner, sitting there now, you know that it was a quarantine breach. So I just can't work out why you're not giving us your best evidence to this committee. You know it was a quarantine breach, don't you?
Look, sorry, Mr Sugars, I said there were also positive staff members in that facility. And what we're doing is getting the best experts we could find to have a look at that and report back to us.
And Ms Moriarty was asking you questions if there was a delay between Parklea becoming aware of infections and you being told. And I still don't understand what your evidence is in that regard. Was there a delay between Parklea being aware of COVID positive cases and you being told about it?
Well, I'm not aware of any delay because, as I said, as soon as Justice Health or St Vincent's Health know about a positive case, the protocol is they immediately advise the command post.
So can you tell us when the first COVID positive case was in Parklea and when you were first notified about it?
Well, I think I indicated that I'd take that on notice.
Ms Hoey, can you explain how it was that at the commencement of this outbreak in August, only 21% of New South Wales prisoners were fully vaccinated. What went wrong?
Thank you, Mr. Shoebridge. The vaccination programme for the custodial officers, for Justice Health staff and for our patients commenced on the 15th of March. We made a decision at that point in time to go with AstraZeneca. There's a few reasons for that. Probably the main one was the stability of the vaccine. So we started with AstraZeneca, going out to all sites. We had a really good schedule. There was 12 weeks in between. We had expected to have it finished in 24 weeks. That was our plan. As we all know, and we've all seen from the media and from the statements and from the Premier and from the Commonwealth, is that there was because of the side effects of AstraZeneca, they changed the timeframes and the ages for that. So it went up to over 50 for AstraZeneca. We then had to, as quickly as we could, change our tact, get some -70 freezers and get ourselves ready for Pfizer. We hadn't done that. So we kept going with AstraZeneca at that point in time. It was over 50s and then it went to over 60s. And then we got some Pfizer into the system in June, and we went out with Pfizer, and we had enough to do first and second doses. We kept that at that point to the metropolitan areas. Obviously, at that point, that's where the outbreak was, and that's where our biggest risk was. As we went through, then the AstraZeneca changed to be from 18 and over, and we continued our vaccination programme with the AstraZeneca and second dose Pfizers for the people who had already been done. Uptake was pretty slow. We had some clinics where there wasn't really many arms to put vaccinations in. So we had, in negotiating with our SHIOC, we got some Pfizer back into the system to make sure that we could vaccinate those who wanted the vaccine and who wanted Pfizer. A lot of hesitancy. We've heard about the community hesitancy. Our Aboriginal population were quite hesitant as well. And we've done a lot of work around that. Really happy with where we're at. And obviously now that Pfizer's in the system, and I think if you look back at the way we have our vaccination rollout has occurred, and the culture around that, I don't think it's that dissimilar from the community. We have really been pushing that. I'd just like to say there's been 21,000 vaccinations given by Justice Health Forensic Mental Health Network since March. We've actually given more Pfizer than we have AstraZeneca. And at this point in time, we've hit our first target, which was 70% first doses, which we're there now. We're sitting at 70.4% first doses. It's been a mammoth effort by everybody. I'm so proud of my staff and for the Corrective Services officers' access to get there. And the other point is that with our Aboriginal population, we've been doing a lot of work around access and around really trying to improve uptake, and Aboriginal population first doses.
Ms. Hoey, I was asking you about why it was 21% at the commencement of the outbreak in New South Wales, and you've given me a number of systemic reasons, the advice from ATAGI and the change in information about AstraZeneca. That's your primary reason, is it? Yeah,
I think that the rollout of the vaccination, as I've said, I'm in record from this from The Guardian, has been bumpy. And it has been a challenge. We're in a challenging environment. There was hesitancy. We did have the AstraZeneca for a while, but once we've got Pfizer into the system from the 5th of the 8th, and it's really interesting because it happened at the same time as Parklea, but it wasn't because of Parklea.
Ms. Hoey, what I find interesting is that those exact same systemic issues were faced by jails in the ACT and faced by jails in WA. You'd agree with that?
I'm not aware of the situation in the ACT or WA. I'm sort of concerned with here right now.
I'm aware of what their vaccination rates, and at the same time, New South Wales prisons' vaccination rates were at 21%. Vaccination rates in the ACT prisons were at 50%, and vaccination rates in WA prisons were at 55%, facing exactly the same external constraints that you were talking about. How did New South Wales get it so wrong? How did you have less than half the double vaccination rates in New South Wales to prisons in the ACT and WA? Will you accept some responsibility for this?
Well, I've got to accept some responsibility, Mr. Shoebridge, but I've told you my reasons for that, and the reasons we've gone out. It wasn't lack of trying. We've been round the state 2 or 3 times with AstraZeneca and Pfizer in the metropolitan areas. And I think we have to acknowledge the work of the staff to get our vaccination rates up. We're extremely proud of what we've done. It's at 70.4 now for first doses. We aim to get over 90. We know what the literature is, and we will continue to progress that.
What's the current double vaccination rates for prisoners?
35.6 for the adult population and 28.7. Luckily, we're using Pfizer, so the second doses for that 70% will come.
Ms. Hoey, prisoners are an extremely vulnerable population because of their health and because of the circumstances in which they're contained. Do you agree with that?
Mr. Shoebridge, you don't need to tell me that. I'm working with it every day, and we're very, very well aware of the vulnerabilities of our patients. So they are
they're currently, under your watch, prisoners in New South Wales have about 2/3 the vaccination rates of people in the general population. Notwithstanding they're a known population, you have direct access to them, and they've been prioritised for months. How is it that they are still only at 2/3 the rate of vaccinations for double vaccinations as in the general community? What is going wrong?
As I've said, Mr. Shoebridge, I've explained my view of what happened. Certainly, the different changes to AstraZeneca, I believe, really compromised the rollout.
It was exactly the same in WA and the ACT, and they haven't got the problems. You can't rely upon that excuse. They had exactly the same constraints in WA and the ACT. You can't rely upon that excuse.
I don't know what you want from me, Mr. Shoebridge. You know, that I've told you what I believe happened. I take responsibility for the vaccination programme. I was the lead of the rollout of the vaccination programme. We're now at 70% first dose. In a couple of weeks, we'll be 70% second dose. The staff are working extremely hard with the patients and corrective services to get this up to where it needs to be.
Were vaccines redirected from prisons to the student HSC vaccination rollout in August?
We did not get any vaccines removed from us. We had our allocations, like nobody took any vaccines back from us. We probably didn't have as much as we would like, but nobody took vaccinations from us. That's not my, no vaccinations went from us to somewhere else.
No, but were your promised allocations reduced to provide vaccines to the HSC rollouts?
That would be a question you'd have to put to our SHIOC. You know, I'm not, I don't oversee the allocation of vaccinations. That's not my role. So you would have to put that. I can take it on notice, but I can't answer that.
Ms. Hoey, the fact is notorious. Are you telling me you can't give evidence about this today, about the redirection of vaccines from prisons to HSC students? This is a notorious fact, being reported in multiple outlets. Are you saying you can't shed any light on that today?
I know that there was a priority to vaccinate the Year 12 students in the Western area. Whether that was a redirection of vaccination from the prison system, I think that's not for me to challenge. I work with SHIOC very closely to ask them, and they supply me with the vaccinations. I couldn't answer what their thought processes were about whether I get vaccinations or somebody else.
Were your allocations, your promised allocations, reduced at or around about that time?
We had Pfizer up until Pfizer's second dose until the 16th of the 7th. We got another batch on the 21st of the 7th, and we were getting a week at that point in time.
I don't think that answers my question. Were your expected dose numbers reduced at or about that time?
That was what we had been supplied, and that's what we'd been guaranteed. It didn't get reduced. That's what we were provided. Like I wasn't said you'll get 2 trays this week and then Wendy, you're only getting 1. I got what I was allocated.
Mr. Miller,
what they did in the background, I don't know.
I'm sorry, Ms. Hoey, I missed that. What did you say?
That what the decision making in the background about the allocations. I wasn't a party to those discussions. That you'd have to take that up with the SHIOC, and I can certainly take it on notice, but it's not something I can answer.
Have doctors or other health staff raised from Parklea raised with Justice Health concerns about the way in which Parklea is managing its COVID outbreak? Have they raised those concerns with Justice Health?
Medical staff.
Doctors or any medical staff?
Have medical staff raised with me the way Parklea has managed the outbreak? Is that what you're asking me?
That is the question.
No, I haven't had concerns about the way Parklea has managed the outbreak. St Vincent's has been managing that, and from all accounts, it's been the actions that they've been taking has been quite assertive. But I'm not across all the actions of Parklea. I obviously knew that there was positive cases because we were taking them into MRC, but I didn't. I've not got comment on their actions from the outbreak.
So there's no ambiguity. The question I'm asking you is this: have any health staff from within Parklea, and that includes the St Vincent's privately run health facilities in Parklea, raised concerns with Justice Health about the level of care and the management of the management of COVID in Parklea since this most recent outbreak? Have they raised concerns with Justice Health?
Not to me directly.
Well, I'm not asking about you directly, Ms. Hoey. I'm asking about Justice Health.
I don't know of any concerns that have been raised.
Will you take it on notice? Because I've got to tell you, I've had multiple people raise these concerns with me and say it's been reported to Justice Health and nothing has happened. So will you take it on notice?
Absolutely. Yeah.
Mr. Miller, you say that you support the inspector's most recent decision to have an investigation in the COVID response. Is that right?
Yes, that's correct.
Do you know when that? Well, sorry, I suppose I'll go to the inspector. Inspector, when did you commence that review?
In the original COVID-19 plan, I foreshadowed that there would have to be a review. It was after the transmission in custody that I decided that now was the time to commence the review.
Ms. Rafter, your website shows that that was uploaded on the 15th of September.
That's right.
Is that when you commenced the review?
No, that's when I published it, and after I had actually formally written to the relevant agencies, I consulted. It took me time to draft the terms of reference, and I consulted with the relevant agencies to let them know that I was intending to commence the review. I'm
not asking about when you first started thinking about the review. I'm asking about when the review commenced. Was it the 15th of September, which is the date which you uploaded it to your website?
Yes, that's the formal commencement of the review, yes.
Ms. Rafter, how is it that only 2 days before you appear before this inquiry is the time you decide to commence a COVID review, given the level of anxiety and the level of concern amongst families and inmates?
No, I didn't decide to do it 2 days ago. As I said, I foreshadowed it at the commencement of the pandemic. If I had commenced the review or commenced the review at that time and delivered a report 6 months ago, it would be a very different type of report, obviously, to what we now know. I started working on the terms of reference. It's about 3 weeks ago that I started working on the terms of reference. It's just that it was formally announced and published 2 days ago. It had nothing to do with this inquiry.
Mr. Miller, did you hear the evidence from the previous panel?
Yes, I did.
The concerns that were raised about the treatment of prisoners, the lockdowns, the lack of access to vaccines, have any of those similar concerns been raised with your office?
Many of them, yes. Given the nature of our role, the concerns and complaints that are raised with us tend to be individual concerns, either from the inmate themselves or particularly in recent times from their family and friends. In ordinary times, we would expect to receive contact directly from inmates. In recent weeks, the extent to which we've been contacted by family of inmates has increased, and there are obvious reasons for that that were canvassed in the previous hearing. A lot of we haven't heard a lot of complaints in relation to vaccination or access to vaccination as such. Most of the complaints we have been receiving are about the impact of lockdowns, restrictions on movements, inability, particularly from families, inability to contact their loved ones in the system. The same sorts of concerns that you heard earlier.
Well, in terms of lockdowns, which facilities have the lockdowns been instigated in?
Well, at one point, the entire state was effectively locked down, and there are different impacts on different centres. And part of the concerns that are raised with us is that some of those lockdowns are essential. For example, if you take Parkley, some of those lockdowns are essential to contain an outbreak, whereas in other centres, some of the restrictions on amenity, if you like, are in response to broader issues related to COVID, but not necessarily a direct suppression technique, if I can put it that way. So things like if there are challenges around staffing at a particular centre, then that may result in certain amenities being reduced.
Well, unfortunately, my time has expired in this round, so I'll hand over to the opposition, but we'll come back to this, Mr. Miller.
Chair, Ms. Hoey, can I ask, so I've been advised, or I've heard that a juvenile justice or youth justice officer has in fact died as a result of COVID. Can you confirm that, or can you give me some information, any further comment on that? I think you're on mute.
Sorry, I'd have to take that on notice for youth justice. Obviously, they're not one of my officers. I don't have the staff, so I'd have to take that on notice.
You don't work with youth justice? You're communicating with them every single day in a teleconference, you told us earlier.
Absolutely, but it's not really my information to share about the officer.
Well, it is if we're asking the question. I don't need the details about the name or where they live. Is it true that it's happened?
I believe an officer has died. I don't know the circumstances. I spoke to the executive director the other night and he advised me of that, but I don't know any of the personal circumstances of why he died. When
did this happen?
When did the executive director and I talk?
No, honestly. Ms. Hoey, when did this person pass away?
I don't know the dates and times. I spoke to the executive director of Justice Health on Tuesday night, about 9 o'clock at night. And that's when he advised me that one of his officers had passed. I honestly have no other circumstance. I do not know the details.
So on Tuesday night, you were advised that a juvenile justice officer had died. I understand that it's a result of COVID. I understand that you might not necessarily have that confirmation, but if you could take the details on notice. I don't want the name. I understand the privacy issues, but this is of public interest.
Oh, absolutely take it on notice and I will get the information for you. It's just I don't have the information to give you.
But it has happened.
I know that an officer, a youth justice officer, had died, and I actually consoled my peer, and I've not got the details of that.
So you have teleconferences, because your evidence is that you have teleconferences with these organisations every single day. You don't have information around it?
No, I don't have information around it.
Wow. My condolences to that person's family. I'm sure there'll be some details around that. I'm also advised that there is a corrections officer who is gravely ill. can you give me some confirmation on that, or the status of other correctional officers who are currently in hospital? Don't need personal details, I just want to know the status.
Ms. Moriarty, I just want to be clear about my role, and my role as Justice Health Forensic Mental Health Network is the care of patients, of inmates in the New South Wales system.
Yes, and I'm trying to find out if that's actually happened over the course of the
I don't look after officers, and I think if there's a custodial officer, I think that question would be better put to Kevin, who may well be able to answer it, but he would be getting looked after in the community. He would not be within my care nor my jurisdiction. Commissioner?
Yeah, look, there are a small number of officers in hospital. I think from Bathurst, there's one from, I think, Community Corrections, and there's also one from Metropolitan Remand Reception Centre.
Right. Commissioner, can I ask you just back in relation to the transfer of people from Parklea? I'm told that there were some inmates who were transferred, or people who were transferred from Parklea to Long Bay without being tested or before results were in, and they were subsequently positive. An entire wing of Long Bay was shut down. Can you tell me if there were any other cases at Long Bay as a result of that?
Look, I might ask Wendy to talk about that one.
Yep, thank you, Ms. Moriarty. I have no evidence of positive patients at Long Bay.
So there's been no positive cases at Long Bay at all?
In patients, no. We have had some staff, I mentioned in the beginning, but there hasn't been transmission. So there's been no patients identified at Long Bay.
No, my question was cases. I didn't differentiate. So have there been cases at Long Bay?
No.
No cases. There are no positive cases at Long Bay, not even staff.
No positive patients yet. As staff, there's been one staff member who was positive. Of my staff members of Justice Health, there's been 7 corrective services staff members who have deemed positive within Long Bay, but there's been no patient transmission or patient cases identified at Long Bay.
I'm very clear about the question. So I've had a few different answers. So there have been positive cases at Long Bay. So you've said 7 staff, and sorry, what was the other part of that? I'm talking about specifics of patients. I'm asking about cases.
Okay, so this is community transmission. So they got COVID in the community, 1 member of staff from Justice Health and 7 from Corrective Services. No patient transmissions and no patient cases.
Thanks. Why has the rollout of vaccination of staff in Corrective Services and across all of these organisations been so appallingly slow?
Yeah, the Corrective Services, when we started the vaccination programme, we had we were doing staff, patients and our own staff. Corrective Services staff and Justice Health staff. Justice Health staff have been 1A, Corrective Services staff have been 1B, those who are in a correctional centre. So as we rolled it out, we've certainly, wherever we've held patient clinics, we've held staff clinics at the same centres. But correctional officers have also had the opportunity to go and get a vaccination at any health hub, at GPs, at pharmacists. So they didn't just have us.
What is the number at the moment? What's the percentage of staff that have been vaccinated?
So from the Justice Health, so the number that we've vaccinated, which would be below the actual percentage. So I can only tell you what we've vaccinated because a number of officers would have gone to hubs and to GPs and to pharmacies. There's from Justice Health's perspective, we've vaccinated 65.7% of Corrective Services officers, and 46.7% of those officers are fully vaccinated. But that's the lowest it could be because that's what we've done.
Thanks. Do you keep records, or do you have records, or is there a requirement for people who've been vaccinated outside of your system to notify you, given that it's now compulsory and within 2 weeks everyone has to have had a vaccination?
Ms Moriarty, I'll just remind you I'm New South Wales Health, so the officers are actually Kevin, so I might put that over to Kevin to answer about his officers and their vaccination rate.
Yeah, thanks very much, Wendy. And look, the reality is, from our perspective, we can't request officers to provide us with that information if they don't want to.
You've just made it compulsory.
Yeah, can I finish though? And we have put out surveys amongst officers, but once we hit the 25th of October, we will be in a position where we can ask for evidence of vaccination. So that will be the trigger for us to get that information.
Sure. So can I ask, what happens to people who haven't been vaccinated by that date? Will they still be able to work? Will they be paid? What are the arrangements that will be in place?
Well, they will have to go on leave until they get vaccinated. Unless they have an appointment to get a vaccination by the 8th of November.
So if they've got an appointment by, when was that? The 18th of?
8th of November.
Of November. And so what about after that? For people who aren't vaccinated, will they be able to work?
No, not in a correctional centre, no.
So what will that mean for them? Has that been communicated to staff?
Yeah, it has been communicated to staff that it is a mandatory requirement for them to be vaccinated by the 25th of October.
Commissioner, can I just, can I just quickly ask, there is a person who is being released either today or at some point soon, Mohammed Scaff. Is he being released on parole because the community reintegration program is closed?
Look, I'm here to answer questions.
Point of order. I'm going to do it this way. Point of order.
Yeah, I'll take the point of order.
That is well and truly outside the terms of what we're doing here today. Like,
to the point of order, Mr. Chair.
I haven't finished. Like,
Sure.
There you go.
Sorry, I thought you paused.
This is about the pandemic response. It's not about the issue that she's now raising.
So to the point of order.
Ms. Moriarty, how do you tie it to the pandemic response? I don't know.
It is directly related to the pandemic response. My understanding is that this program, the community reintegration program, is closed because of the pandemic. So it's not just this person. There are a number of people that this affects in the system who would otherwise be up for parole, but because they can't complete this program, they won't be released. So it is directly relevant to this inquiry.
Well, I'll allow the question about whether or not that program has been shut because of COVID-19. Assistant Commissioner, can you shed any light on that?
Yeah, I think I mentioned, my introductory statement that external leave programs have been ceased unless there is some, a special or extenuating circumstance.
Thanks. I think I'm out of time. I might just squeeze in a question then in relation to where we were at the end of my last session. So what is the advice? So Commissioner, you've confirmed that your organisation is directing staff to return to work before the 14-day isolation period is finished, which is not in line with the health advice the rest of the community is subjected to. So what advice are you relying on for that, and why are you doing it?
Yeah, sure. Look, if what we've got is a situation where we were able to do very nuanced analysis of each individual person's contact with a COVID positive. So that information is fed through to population health, and then they make a determination. So if it's a high risk contact, 14 days, multiple tests. If it's low or moderate risk, then they can return earlier. And that's the advice we get from health.
Sorry, Ms. Moriarty, your time has expired. Assistant Commissioner, perhaps you can tell us the number of COVID cases by facility of inmates.
Sorry, I missed the question, sorry.
Can you tell us the number of current COVID cases amongst inmates by facility?
Sure, just, I can do that. I think Wendy already identified those, but Wendy, do you want to respond to this?
Yeah.
I think Wendy gave Justice Health and staff numbers.
Mr. Shoebridge, if I may, I have the numbers here of positive cases across the New South Wales system at this point in time. That's what you're asking? So
Yes, inmates.
Yeah. So at MRRC, which is our remand centre at Silverwater, there is currently 94 positive cases being cared for. 16 of those are Aboriginal. At Silverwater Women's Correctional Centre, there is 6 positive cases, 2 of whom are Aboriginal. And in the Youth Justice Centres at Coburn, there is 2 positive cases and 1 person there is Aboriginal. And that's because the policy is that we, as soon as a positive case is identified, they are then transported down to either MRRC, Silverwater Women's or Coburn Youth Justice Centre, so that we can make sure that we can provide the appropriate care and they're close to a tertiary hospital should they require transfer.
So are the 2 in youth justice both at Coburn?
Yes, they are.
And can either of you shed any light on the numbers in Parklea?
I would have to pass you back to Kevin.
Assistant Commissioner.
So the current active cases in Parklea are 85.
All right.
Yep.
Sorry, Assistant Commissioner, did you add something about that?
No.
I've had a number of families contact me about very real concerns about the treatment within Parklea. One of the concerns is that hand sanitizer has been withdrawn from inmates because the prison authorities there are saying that there's a risk that inmates will consume it. Has that information been provided to you, Mr. Miller, in any way?
Not that I'm aware of, Mr. Shoebridge, but I can check whether we've received any concerns in that regard.
Assistant Commissioner, when people are being released from prison out into the community, given that the prevalence of COVID in prisons is about 10 times higher than it is within the broader community, what control measures are in place to ensure that those communities and the families that those former inmates go into are protected?
Look, what we're doing now is testing everybody before they go out into the community and waiting for those tests to come back. When we don't have the results back, we make sure that we've got suitable places for them to go. And I think Wendy might be able to tell you about some of the patient transport scenarios that she's just been negotiating to make sure that we can get people out into appropriate places for them to quarantine in the community. Do you want to talk about that, Wendy?
Yeah, thank you, Kevin. I kind of missed the last bit of your question, Mr. Shoebridge, but the release of patients clearly is a challenge. It's been a challenge for us, and it's certainly a challenge for the communities that they're returning to. That really came to light with the Bathurst situation, which we've reviewed and learned from. We've got quite a intricate flowchart of what we're doing with people who are being released now. Just to put it in place, we do sentinel testing for everybody who comes in. So anybody who's coming through the police cells now gets a rapid antigen screening. And that's
sorry, we only have limited time, so I'm really just focused on the release.
Tell me the question, and I'll try and be pointed.
The question is, what protection measures are in place for the community and family members of people who are exiting prison, given that the prevalence of COVID in prisons is 10 times the rate that it is in the general public?
Yeah, I think what we have to remember is that the prisons that we know, the prisons that there's a risk. So that currently is Bathurst, MRRC, Silverwater Women's, and Coburn, because we're bringing everybody down to that area. We've got really strong discharge planning processes, that there'll be a COVID plan, a COVID health plan or COVID plan in place before anybody leaves those centres. and testing a rapid antigen screening before they leave. For those people who are in 14-day quarantine because of symptomatology or because of close contacts, or in fact they're positive, we liaise very closely with the local public health units, and we assess their housing conditions and their ability to quarantine or isolate if they need to. We did have some real trouble with transport, so we've now got ourselves a COVID trained person to be able to transport people to appropriate accommodation, and that may well be the SHA, which is the health accommodation. It may well be home if they're able to do home, or wherever they can safely quarantine. So we're also working very closely with the magistrates and the lawyers around bail and how we can support that, because sometimes it happens and we've got to get our things organised really quickly. So we're working very, very closely with those fraternities to do what we can to make sure that when people are being released, they're being released into a safe environment for themselves. The other thing is obviously the people who are getting released from classification who have been in prison longer than COVID, and we're taking a lot of time to ensure that they know how to protect themselves out into the COVID world with masks.
Our time is limited. I was really after the policies and the protocols in place, but perhaps you might give some actual detail on notice. Ms. Hoey, are you working with the Aboriginal Medical Service to reach Aboriginal inmates in New South Wales to ensure you get the maximum rollout of vaccinations?
Yeah, we've last week or the week before, I can't remember, they're rolling into one. We actually met with quite a large group, a forum of Aboriginal leaders and representatives with Kevin and the Secretary to discuss and hear their concerns. And from that meeting, we've really got some good processes happening. We met yesterday with some elders to come into the Youth Justice Centre, so we're getting some aunties and uncles to come in.
I'm sorry, my time is limited. Are you working with the Aboriginal Medical Service to ensure you get the maximum reach of vaccinations to Aboriginal inmates in New South Wales? And if not, why not?
I don't understand your question.
Are you working together with the Aboriginal Medical Service to get maximum outreach of vaccinations to Aboriginal inmates?
So are you saying them coming into the centres to help us with the vaccinations? That's not occurring.
Yes, them coming into the centres. So that's not happening.
No,
Have you sat down and worked out a communication strategy with the Aboriginal Medical Service?
Yeah, we've got a number of MOUs with them. Certainly with Wellington, I've been in big discussions with them.
Ms. Hoey, I'm asking about a communication strategy about vaccinations, not a general MOU. Is there one in place with the AMS?
I don't think I've got what you're looking for, Mr. Shoebridge.
Ms. Hoey, all I'm looking for is the best way of protecting inmates and ensuring you get the maximum rollout of vaccinations. And it seems remarkable that you're not working with the peak Aboriginal Medical Service body to get vaccinations into inmates who are in your care. And I can't understand why you haven't been doing that. Can you explain why?
As I said, we met with the Aboriginal groups last week. It was a Wednesday last week or the week before, whenever the day before the Guardian, to listen to their concerns and to work out how we can work closer with them. I haven't written a communication strategy, no. Are we working with Aboriginal groups? Yes, we are, but we've not got a strategy written.
Well, Ms. Hoey, you had 21% double dose vaccination rates at the beginning of this outbreak. A quarter of the inmates in male prisons, a third of the inmates in female prisons are Aboriginal women and men, and you haven't worked with the Aboriginal Medical Service. How on earth do you explain that?
Well, as I said, Mr. Shoebridge, our vaccination rates, we've worked really, really hard to improve them, and we have. And you know, we're working hard. We're closing the gap between Aboriginal and non-Aboriginal vaccination rates very, very quickly. I've told you we've met with the Aboriginal community, we've met with the Aboriginal leaders to understand their concerns.
You told me, Ms. Hoey, you told me you met last week. This has been a crisis that should have been on your radar since March of last year, and you met with Aboriginal groups last week. that strikes me as negligent, Ms. Hoy. Do you have a response to that?
I don't think it is negligent. We work quite closely with a lot of the Aboriginal corporation. We've got our Aboriginal strategy team who work very closely with them. I've got Aboriginal health workers on the ground who I've kept in touch with all the way along, who are working, they're working directly with the leaders within the prison environment to try and get the word out there and to improve. So it's not that we haven't done anything.
Well, Mr. Corcoran, do you know now how it is that COVID went from the Bathurst facility when an inmate was released and then seeded into Western and Far Western New South Wales? Do you know what went wrong?
Yeah, what we do know is that we didn't get the test back until 2 days after that individual was released from custody. And as I said, that was a really unfortunate event, and we've learnt a lot of lessons from that. And we've got a whole range of protocols in place to guard against that sort of thing happening again.
Unfortunately, I think the time has expired. I know we all would have enjoyed a little bit more time here, but that unfortunately brings this session to an end. Can I thank all of you for your attendance today? I think a number of questions were taken on notice, and if we could get those answers in a maximum of 21 days, that would be greatly appreciated. So thank you, everybody, for your attendance today.
Thank you.
Thank you.